first of all, I'm going to do just a general inspection, and I'm looking at Savannah, and I see that her skin is intact. No lesions or masses noted. I don't see any edema. Savannah, I'm going to go ahead and touch your skin. Savannah's skin is warm, dry, and intact. And looking at her hands, going to go ahead and inspect her nails. Her nails are well groomed, they're short. Her nail beds are pink and firmly affixed to her fingers, or her nails are firmly affixed to the nail beds. Her capillary refill on all digits is less than 2 seconds. And let's see. Savannah, can you go ahead and do this with each set of your fingers so that I can see the, kind of hold your hands up so that I can see. And Savannah's angle looks about 160 degrees. No clubbing is noted. I don't see any ridges on her nails. Let's see. Savannah, I'm looking at your head, and your head is normocephalic and oval. All your features are symmetrical. The eyes, the nose, the mouth are all symmetrical. The ears also symmetrically placed, and the ears are in line with the outer campuses of the eyes. Looking at the hair, Savannah's terminal hairs are evenly distributed on her head. Her eyebrows and her eyelashes are also evenly distributed. I'm inspecting the hair and the scalp. Savannah's hair is light brown. There are no lesions noted. There's no infestation. Savannah, is your scalp tender at all?
No.
Okay, scalp is non-tender. I'm looking at Savannah's neck. I'm going to palpate the trachea. The trachea is midline. And now I'm going to palpate your carotids. And the carotids are +2 bilaterally. I am going to go ahead and get a cup of water. We're going to check your thyroid, okay? What I'd like for you to do is take a sip of the water and hold it in your mouth, and then when I tell you to, I'd like for you to lean your head a little bit forward, and I'm going to feel your neck while you swallow, okay? So go ahead and take a sip of water. Good. All right, go ahead and lean forward, and then if you would please swallow. Great. And no nodules or masses were noted on the thyroid with swallowing. The cricoid process did raise with swallowing. I'm going to listen now to her carotids and to her thyroid with the bell of my stethoscope. No bruise to the carotids or to the thyroid. Okay, Savannah. So now we're going to go through some eye exercises. Let's see. We are going to, we're going to palpate your lymph nodes. I'm also noting that there's no jugular vein distension. Now I'm palpating the lymph nodes. We're going to start on the occipital nodes and the posterior cervical chain, the post-auricular, pre-auricular, tonsillar, submandibular, and the submental. the anterior cervical chain. Savannah, if you would shrug your shoulders forward, the supraclavicular. It's hard to work around this. Good. And the axillary. The epitrochlear. Was any of that tender? No. Okay. So lymph nodes were non-palpable and non-tender. Now we're going to assess your eyes. Can I get my pen light? And so we're going to start by palpating your eyes. Looking at her eyes again, her eyelashes are evenly distributed. So then if you close your eyes, I'm going to palpate the eyeballs, which are firm. The lacrimal apparatus is soft and without exudate. You can open your eyes. I'm going to lift the eyelids, and no ptosis is noted. The conjunctiva are white. The iris are green bilaterally. The pupils are even. Savannah, I'm going to go ahead and just use my light. I'm going to shine it on the bridge of your nose. If you want to look at a spot beyond me against the wall, that would be great. And as I look at the eyeballs, the pupils are even. And then as I move my light, they are consensual, and so they dilate equally. When I shine the light on the right, the left also dilates with the right, and when I shine the light on the left, the right dilates with the left. We'll go ahead and we'll do the ophthalmoscopic exam. I'm going to start by going right eye to right. And I'm going to so then look at a spot on the wall while I look into your eye, okay? And I'm going to start by capturing the red reflex. And I'm bracing. And once I capture the red reflex, I'm moving in. The optic disc is visualized, and it is round and well defined, and no hemorrhages are noted to the vessels. Okay. Now I'll go left eye to left eye, and again focus on the point on the wall, and I am going to brace, and then I am capturing the red reflex. And then I'm moving in. The optic disc is visualized, and it is well defined. There's no nicking, no hemorrhaging to the blood vessels. Savannah, we're going to do something called the cover-uncover test. What I would like for you to do is just for 1 or 2 seconds, place your left hand over your left eye, and then after 2 seconds you can remove your hand, and now do the same with your right, and then remove your hand. No nystagmus is noted. Let's see. Okay, so there are 2 eye charts that can be used. There's the Snellen eye chart, and that's generally placed on the wall and at a distance of about 20 feet. And there are varying sizes of letters on the chart, and there's a fraction associated with each line, and the number that correlates to the top part of the fraction refers to the average distance that a person can read it with without a problem. and then the bottom again is the bottom of the fraction is a 20, and that refers to how far the patient is standing from the chart. What we're going to use is the Rosenbaum chart, and that test the near central vision, and so we're going to place that 14 inches away from Savannah, and then she's going to read it, and then it has numbers that correlate to the Snellen chart. Savannah, 14 inches is about where my fingers are. So then if you would go ahead and cover one eye and read the smallest line possible.
LTFPH.
Okay, and that was the smallest line, which was a 20/20. Now if you would go ahead and cover your right eye, or your left eye, sorry, do the same.
LTFPH.
Great, and so Savannah read at 20/20 for both the right and the left eye. All right, Savannah, so now what we're going to do is called the 6 cardinal fields, and so what I'm going to do is I'm going to hold my pen light here, and what I'd like for you to do is follow this just with your eyes, okay, not with your head. So we're going to, good. Good. And that's the EOM, and Savannah followed in all 6 fields, and that is the trochlear cranial nerve 4, which controls eye movement, and it also was the abducens, which is cranial nerve 6, which is coordination. And let's see, now we're going to go ahead to the ears. Savannah's ears are symmetrically placed on her head, and as I said earlier, they're in line with the outer campuses of her eyes. I'm going to palpate the outer ear. The pinna and the earlobe are without lesion or nodules bilaterally. Both ears are pierced one time. Savannah, anything that I do, if it causes you discomfort, make sure and let me know, okay? And so now what we're going to do is the otoscope exam. So I'm going to look in your ears, get a speculum. And I'm going to be pulling up and back with the pinna, and we're going to insert the speculum. I'm looking at the ear canal, which is clean and without exudate or erythema. I am visualizing the tympanic membrane, which is pearly gray and intact. The malleus is visible, and the cone of light is at 5 o'clock. Savannah. Again, I'm going to be bracing with my pinky. I'm pulling the pin up and back. I am inserting the speculum. I'm visualizing the ear canal, which is, again, free from foreign bodies, and there is no exudate or erythema. The tympanic membrane is pearly gray and intact. The malleus is visible, and the cone of light is at 7 o'clock. Savannah, I'm going to do something now called the whisper test, and so I'm going to stand behind you, and if you would, go ahead and cover your right ear, and I'm going to say a word, and then you're going to tell me what I say, okay?
Pineapple.
Great. Now I'm going to come around, and you're going to cover the other ear, and I'm going to say another word, and if you cover the other ear.
Coconut.
All right, and Savannah correctly repeated the words pineapple and coconut, and Let's see, that tested cranial nerve 8, which is the vestibular cochlear nerve. Savannah, now we're going to inspect your nose. Crane speculum. Savannah's nose is midline. Savannah, I'm going to palpate your nose. Just tell me if anything's tender. The nose is non-tender. Can you cover one side of your nose and then breathe through the other? And now do the opposite side. So the nares are patent. I'm going to be looking at the, sorry, I'm going to bring this around behind you. I'm going to be looking at the nares. I'm going to be bracing with my pinky, and I am looking in the nares, and the turbinates are pink and moist. And again, bracing and inserting the speculum, and the nares are pink and moist. The septum is intact. Okay, Savannah, I'm going to palpate your sinuses, okay? Just tell me if anything hurts. So the frontal and the maxillary sinuses are non-tender. Let's see. Oh, no. Okay, Savannah. So now we're going to be looking at your mouth. Savannah's lips are symmetrical. They are pink and moist. Savannah, can you open your mouth and stick out your tongue? Good. The tongue is pink and moist. Can you move your tongue side to side? Good. And can you lift your tongue up so I can see underneath? Good. And now if you would, I'm going to go ahead and look inside your mouth. And the buccal mucosa is pink and moist as well. She has, open your mouth a little wider. A full set of pearly white teeth. I don't see any caries. Go ahead and stick your tongue out again. If you would, go ahead and say ah. Okay. And so the uvula did rise with phonation, and the gag reflex is intact. Savannah was able to stick out her tongue and move her tongue from side to side. We tested cranial nerve 12, which, oh no, we didn't. Push your tongue against your cheek. Okay, that's cranial nerve 12, which is the hypoglossal, and that tests the strength of her tongue muscle. The gag reflex referred to cranial nerve, I believe 8, the glossopharyngeal. Now we're going to go ahead and we are going to move to the chest. I'm inspecting Savannah's chest. Her skin is intact. Her skin tone is even. Her respirations are normal. She has good chest expansion. Savannah, I'm going to just go ahead and place my hands on your spine, and if you would take a nice deep breath for me. Good. And her chest rise is symmetrical. Savannah, first thing we're going to do is I'm going to percuss the lung fields. And so I'm just going to tap supraclavicular, second intercostal space, maxillary. And there is resonance throughout. Savannah, I'm going to place my hand on your chest, and if you would repeat 99. Say 99.
99.
And again.
99.
And again.
99.
Good.
99.
Okay. And that was checking for tactile fremitus. Savannah, now I'm going to go ahead and I'm going to listen to your lungs. Listening now with the diaphragm of my stethoscopes in order to capture the higher pitch sounds. If you would take a nice deep breath for me. And over the trachea I hear bronchial breath sounds, and expiration is greater than inspiration. And now listening over the bronchia. Good. And then breath sounds are bronchiovesicular, and respiration is equal to inspiration. Go ahead, nice big breath through your mouth. And over the periphery. And I hear vesicular breath sounds, and the inspiration is greater than expiration. Now I'm listening at her back. If you would turn a little bit on the table that way. Go ahead, just continue to breathe. Okay, and lung fields are clear throughout. Savannah, I'm going to go ahead now and just check for costovertebral tenderness. Tell me if that hurts. Okay, no pain? Okay, so no costovertebral tenderness. So now we're going to go ahead and I'm going to listen to your heart. Also, I'm going to be listening with the diaphragm to pick up the higher pitch sounds. Additionally, I would listen with the bell to pick up the lower sounds such as murmurs. Okay. So I'm going to start at the second intercostal space on the right sternal border, and I am listening to the aortic area, and S2 is greater than S1. Now I'm listening to the second intercostal space on the left sternal border, and that is the pulmonic. Now the third intercostal space on the left sternal border, and that is Erb's point, and S1 is equal to S2. And now the fourth intercostal space on the left sternal border. And that is the tricuspid. And S1 is greater than S2. And now at the mitral This is also called the mitral region, the apical region. And I'm going to listen here for 1 full minute. I need my watch. And the apical rate is 82 beats per minute, and it is a regular rate and rhythm. And so now we are going to inspect your abdomen. If you wouldn't mind laying down for me. And the first thing I'm doing is inspecting. She does have a piercing to her umbilical region. The abdomen is smooth and flat, and there's no masses or lesions noted. Savannah, I'm going to go ahead now and I'm going to listen to your tummy. Okay, and there are normal active bowel sounds in all 4 quadrants. Now I'm going to percuss over all 4 quadrants as well as the gastric bubble. And tympani is heard throughout. Now I'm going to perform light palpation. So Savannah, I'm just basically going to run my hands over your belly, and if you would tell me if anything hurts, okay? Any discomfort whatsoever. Pull this down just a little bit more. She also has tattoo here on her left lower quadrant. Any discomfort? Okay, so now I'm going to palpate a little bit deeper, okay? And just again, tell me if anything hurts. No masses were noted, no tenderness. So now what we're going to do is we're going to percuss the liver margin, and we're going to do that by percussing from a point of tympani to a point of dullness, and then down from the rib cage again to where it's dull to a point where we have, or from tympani in the chest down to a point of dullness. The normal liver span is between 6 and 12 centimeters. Relax your belly. Move your bra, okay. center. And I measure at 6 centimeters, so that's within the normal limits. Now, Savannah, I'm going to just percuss for splenic dullness. Which we find up here in the rib cage around the 5th intercostal space. And now what we're going to do is check for Murphy's sign. A positive Murphy's sign might mean gallbladder or liver problems, but what we're going to do is I'm going to have Savannah take in a deep breath, and I'm going to wrap my fingers around her right rib cage to see if she has any tenderness there. So if you would just take a deep breath and let it out. Okay. Any pain? Okay, so there's no, or it's a negative Murphy sign. That's an help up. Great, good job. All right. All right, Savannah. So now what we're going to do is we're going to check range of motion. So we're going to start with your cervical spine, which is basically your neck. And what I'm going to have you do is look up at the ceiling, and that is extension. And I'm going to have you put your chin to your chest, which is flexion. Good, look back at me. And I'm going to have you turn your chin towards your shoulder. And now turn your chin back towards the other shoulder, and that shows good rotation. Savannah, on your shoulders, if you would put your hands above your head, that's abduction. And I want you to put your hands behind your back, and that's adduction. And now if you would reach your hand over and touch your opposite shoulder, and then do the same. Okay, good. And so now I'm going to have you lay back down, and we're going to check your hips. Now, this is going to be passive range of motion, and what I'm going to do is I'm going to bend your leg for you, okay? So we're going to bend the knee to about 90 degrees, and then we're going to rotate the hips to the outside, external rotation, internal rotation, and we're back at flexion, and then we're back at extension. And we're going to do that for the opposite side. So we're flexion, and then we're going to go with external rotation, and then we're going to go back to internal rotation, and then we're going to go back to extension. Great. Now, while I have Savannah on her back, we're going to go ahead and do her knees. Savannah, what I'd like for you to do is just go ahead and bend your knee. That's good. So we have flexion and extension of the knee. Go ahead and do your other one. Now what I'm going to do is the drawer test. And that is the anterior draw test, sorry. And the way we're going to check that is we're going to bend that knee back up to 90 degrees. And then both knees. And I'm going to sit on your feet with my leg. And then what I'm going to do is place my thumbs on the anterior portion of her knee. My fingers are curled behind her knee. And just going to go ahead and pull forward. And what that does is checks the integrity of the ACL. We had no movement. Now we're going to do the same on this side. And we have no movement again, so that's good. That's it up. Good job. All right, so now we're going to go ahead and check your ankles. So exactly, if you would raise your toes up to the ceiling, and that's dorsiflexion. And now put them back down. And that's extension, and now I'm going to have you stand up for me or hop down, and if you would turn sideways Now bend over and touch your toes if you can without bending your knees. And I'm inspecting the spine. And the spine is straight. This is also, by the way, lumbar flexion. Go ahead and stand up. It was also checking for scoliosis, and I noticed no curvature. Her scapula are even, her shoulders are even, and her hips are even. And now, Savannah, if you could just kind of lean back for me as far as you can without falling over. Good. And that is extension of the lumbar muscles. Go ahead, you can stand forward. Now, if you would turn back around this way. Okay, Savannah. So now what we're going to do is we're going to pause and think. I did. Go ahead and sit up on the table. So what we're going to do now, I didn't do your elbows earlier. So what we're going to do, this is extension, and this is supination, and then this is flexion, which is great. And then we'll do the same here. So extension, supination, and flexion, good. And then with the shoulders, we can also do that here, relax your arm, and this here, supination, and that's good. Do the same here. Good. And now we're going to check your wrists, if you would put your hands out. And so what we're going to do is flexion, and we're going to do extension, and then we're going to do side to side, which is supination and pronation. Good. And now if you would, I want to take off your socks so that I can check your feet. And I'm going to, I can't check the cap refill. She has toenail polish on, but her cap refill on her toes should also be less than 2 seconds. Let's see. We're going to go head to toe now, and we're going to check some pulses. We have the temporal. We already did the carotid. We're going to do the brachioradialis. If you would put your arms this way. Good. Radial. Post-tibial. Relax your legs. And the dorsalis peaks. And the pulses are 2+ throughout. Now we're going to check some deep tendon reflexes. Okay. So we're going to start with the bicep. Good. Okay. Now we're going to do patellar. Okay. All right, Savannah, now if you would, we're going to go ahead and check the Babinski reflex. And so I'm just going to run this up your foot. Okay, and if you could try not to, she's very ticklish, I'm sorry. So Babinski's reflex would be the toe curls back, which she doesn't actually have, but she is ticklish. And so that's normal. Let's see. Coordination, Savannah. I have a couple of things, and balance that I want to check. If you would stand up. Can you close your eyes for me and just stand there a couple of seconds? And Savannah's able to stand with her eyes closed and maintain her balance. Okay, now what I'd like for you to do, go ahead and close your eyes again, and then I would like for you to touch your finger to your nose like this, and you can do it several times repeatedly with your eyes closed. Okay, that's great, thank you. And now go ahead and sit back up on the table. And what I'd like for you to do is put your palms down. Now what I'd like for you to do is go back and forth between the palms in your back of your hand as fast as you can. Good, and Savannah has good coordination. Thank you. And now Savannah, what we're gonna do is sharp and dull and light sensation, light sensation. And so you're just gonna tell me if something is sharp or dull, okay? I'm gonna just touch you either like on your forehead or your arms or your legs. And then you can tell me this would be sharp and this would be dull, okay? And so I want you to just tell me what you feel. I'm gonna have you close your eyes, okay? All right, and so
Dull.
dull, good,
Sharp.
good. And here,
Dull.
and here,
Sharp.
good. And here, it's hard with your spandex on there. I want to do it again.
Sharp.
Oh, it's dull. Here, I'll do it down here.
Dull.
Okay.
Sharp.
Good. Okay. And so Savannah is able to distinguish between sharp and dull. And finally, let's see. We are going to just review the cranial nerves. We have olfactory, which we're not checking today, and that's cranial nerve 1, which would test her sense of smell. The optic nerve is cranial nerve 2, and that is sensory, and that is for vision. We have the oculomotor nerve, which is motor, as it states, and that controls eye movement. We have the trochlear nerve is cranial nerve 4, and that is a mixed nerve. And we have, and that helped us with the 6 fields of eye movement. And then we have the trigeminal, which is also mixed. And the trigeminal was with, we didn't do the facial movements, but we can do that now, Savannah. So if you would, squeeze your eyes closed. Good. Now can you open them? Smile, frown, puff your cheeks out. Good and good. Okay, raise your eyebrows. All right. And so the trigeminal would be intact as the, I think that's right. And then the facial nerve is 5, and that is, or 6, and that is the sensation on her face. Then we have the facial was 7, and 6 was abducens, which was motor and its eye movement. 7 was facial, and that was the muscles of the face. Vestibulocochlear is for hearing, and that is sensory. Savannah, just occurred to me we missed another little test. The Rhine and Weber tests, and they check your response to the vibration and hearing. And what I'm going to do for that is I'm going to strike the tuning fork. And for the Rhine test, I'm going to place the tuning fork on the top of your head. And for the Weber, I'm going to hold it on your mastoid process, and you're going to tell me when you no longer hear the vibration. Okay. Can you hear this with both ears? Okay. And so she should be able to, and she should hear it equally on both sides. And now I'm going to do this again. I'm going to hold it on the bone behind your ear, okay? And you're going to tell me when the vibration stops. Okay, and how about now? Stop? Still hear it? You know when it stops. And so her air conduction was longer than her bone, and she was able to continue hearing that. I'm going to do the same thing again. Tell me when you no longer hear it.